Hi students, today we are discussing about the types of ELISA. Generally we can see that the three types of ELISA based on the binding structure between the antigen antibody reaction or based on the antigen antibody reaction. Generally we can see the three types of ELISA: direct ELISA, indirect ELISA and sandwich ELISA. First, you notice the difference between the direct ELISA and indirect ELISA. You already know that the ELISA is an antigen-antibody reaction, and with that antigen-antibody reaction, enzyme-linked antigen or antibody interact with the already binding antigen-antibody, and the enzyme is detected by using a substrate. You can see that the direct ELISA, the well is coated with the antigen and the enzyme conjugated antibody is added directly into the antigen, and it will form the antigen antibody enzyme complex. Into that antigen antibody enzyme complex we are adding substrate, then we will get a definite color. In the case of indirect ELISA, the well is coated with antigen and we are adding primary antibody followed by adding the secondary antibody with the enzyme conjugated antibody. The secondary antibody is the enzyme conjugated antibody. So indirectly we are detecting the presence of specific antibodies in the serum. That is antigen, antibody, then antibody with enzyme. And when we are adding the substrate to the particular complex, we give a definite color because of due to the enzyme conjugated antibody that already bind to the antibody present in the serum, and that antibody is bind with antigen. For example, for the detection of HIV, we are taking the serum from sample, and our well, that is our kit, that is diagnostic kit, already bound the antigens of HIV. When the serum containing the antibody of HIV, that antibody binds with the antigen, HIV antigen in the wells, and the antibody is consisting of enzyme, that is direct ELISA, that is detection of HIV by direct ELISA. Then in the case of indirect ELISA, HIV antigen is already present in the wells and the serum containing antibody binds with HIV antibodies binds with antigen, and then we are adding enzyme conjugated antibody, then will form the enzyme conjugated antibody antigen complex. So when we are adding a substrate to that particular complex, we give a definite color. Then you can diagnose it as a positive test. So in the case of a direct ELISA, we can detect the antigen antibody reaction directly. In the case of indirect ELISA, we are detecting the antigen antibody by incorporating a secondary antibody with enzyme to the antigen antibody reaction. Indirect ELISA used to detect antigen in a test sample. The test result can be positive or negative depending on the presence and absence of antigen in the test sample. So direct ELISA is used to detect the presence of antigen in the test sample. You can see the two patients, patient 1 and patient 2. We are taking the serum of patient 1 and patient 2. In patient 1 consisting of a specific antigen. In step 1, the antigen present in the patient serum sample are absorbed and immobilized in microliter wells. So that antigen is absorbed into the wells of microliter wells. Then wells are rinsed to remove any unbound antigens. So unbound antigen washed off from the wells. Then step 2, we are incorporating the enzyme conjugated antibody. Then this enzyme conjugated antibody react with the already present antigen in the wells and form antigen antibody complex, and the unbound antibody is washed, that is enzyme conjugated antibodies are washed by using the procedure washing. In step 3, a substrate or chromogen that imparts color for the enzyme is added, that is enzyme linked antibody is added. The substrate is added to the wells. The color develops in first due to the presence of enzyme linked specific antibody in the wells. So direct ELISA. First we are adding antigen, this unknown antigen. Then we are adding enzyme conjugated antibody. When we are adding a substrate, we use color, it is positive test.